Lidocaine ointment is used to temporarily numb and relieve pain from minor burns, skin abrasions, insect bites, and other painful conditions affecting mucous membranes. It can also be used to numb the lining of the mouth or throat before certain medical or dental procedures. Additionally, it can decrease pain while dentures are being fitted and while your gums are adjusting to the dentures. However, it should not be used long-term to decrease pain from poorly fitting dentures. It is important to note that lidocaine ointment should not be used to treat teething pain in infants and young children due to an increased risk of serious side effects. If you have any concerns about using lidocaine ointment for your specific situation, it is best to consult with your doctor for more details and for other ways to treat the pain. Before using lidocaine ointment, make sure to read the instructions provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. If you're using this medication for medical or dental procedures, it's usually applied by a healthcare professional. If you're applying it yourself, make sure to follow the directions given by your dentist or doctor. Be careful to avoid getting the medication in your eyes, and only apply a thin layer, using the smallest amount needed to cover the affected area. The dosage will depend on your medical condition and how you respond to the treatment. For children, the dosage will also be based on their age and weight. It's important not to increase your dose or use this medication more often or for longer than prescribed. Doing so won't improve your condition any faster and will increase your risk of side effects. If you're using lidocaine ointment to relieve pain from new dentures, make sure to apply the ointment with clean hands to all surfaces of the dentures that touch your gums. To reduce the amount of lidocaine that may be swallowed, avoid applying the ointment to the chewing surfaces of your dentures. Also, make sure to follow your dentist's instructions carefully and wash your hands after use. When using this medication in the mouth or throat, numbness may make swallowing difficult and increase your risk of swallowing the wrong way or choking. So, avoid chewing gum or eating for 1 hour after using this product while your mouth or throat is numb. It's especially important for children to not eat or chew gum for at least 1 hour after using this product. And be careful not to accidentally bite your tongue or mouth. If you're applying this medication to other mucous membranes or the skin, make sure to clean the affected area before use, if possible, and apply with clean hands as directed. For broken or burned skin, you may apply the ointment with a sterile gauze pad. And don't forget to wash your hands after use, unless you're treating an area on the hands. Lidocaine starts to numb the affected area within 5 minutes after application. If you're using this product before certain procedures, make sure to tell your doctor if the area doesn't feel numb or the numbness doesn't go away. And if you're using this product to relieve pain or discomfort, tell your doctor if your condition lasts or gets worse. If you experience mild stinging or burning, it's important to let your doctor or pharmacist know. However, many people using this medication do not experience serious side effects. But, using too much of it or being very sensitive to its effects can cause very serious side effects, such as dizziness, drowsiness, slow/shallow breathing, mental/mood changes, shaking, seizures, vision changes, ringing in the ears, fainting, pale/bluish/gray skin, unusual tiredness, shortness of breath, and fast/slow/irregular heartbeat. In rare cases, a very serious allergic reaction may occur, with symptoms such as rash, itching/swelling, severe dizziness, and trouble breathing. It's important to seek medical help right away if you notice any of these symptoms. If you experience any other effects not listed, it's important to contact your doctor or pharmacist. Remember, it's important to use this medication as prescribed by your doctor, as they have judged that the benefit to you is greater than the risk of side effects. If you have any concerns, be sure to discuss them with your healthcare provider. Before using lidocaine ointment, make sure to inform your doctor, dentist, or pharmacist if you have any allergies to anesthetics. Also, let them know about any cuts, sores, infections, heart problems, liver or kidney disease, or if you are pregnant or breastfeeding. This medication can make you dizzy or drowsy, so be cautious when driving or using machinery. It's important to talk to your healthcare provider about any other medications or herbal products you are using, and if you are using marijuana. Additionally, be aware that children may be more sensitive to the side effects of this drug. If you are pregnant or breastfeeding, it's essential to discuss the risks and benefits with your doctor before using this medication. When using lidocaine ointment, it's important to be aware of potential drug interactions. This means that other medications or products you are using may affect how lidocaine works or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not make any changes to your medications without consulting your doctor first. If you are using other lidocaine products at the same time as this medication, be sure to inform your doctor or pharmacist. This is important because using multiple lidocaine products at once may increase your risk of serious side effects. If someone accidentally swallows this medication, it can be harmful. If the person has serious symptoms like passing out or trouble breathing, it's important to call 911 or a poison control center right away. Symptoms of an overdose may include changes in vision or hearing, severe dizziness or drowsiness, fainting, shaking, seizures, slow or irregular heartbeat, and slow or shallow breathing. It's important to seek medical help immediately if any of these symptoms occur. This medication is for use on the skin only. Do not apply inside the mouth, nose, or in the eyes. If this medication gets in the eyes, rinse thoroughly with water. Do not use large amounts of lidocaine ointment, or cover treated skin areas with a bandage or plastic wrap without medical advice. Be cautious to avoid using other medications on the areas you treat with lidocaine, unless your doctor tells you to. If you forget to apply a dose of lidocaine ointment, apply it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Use the next dose at the regular time and do not apply double the amount to make up for the missed one. It's important to store lidocaine ointment topical local anesthetics at room temperature and avoid freezing it. Keep it out of reach of children and pets. When you no longer need it or when it's expired, make sure to properly discard it. You can consult with your pharmacist or local waste disposal company for the correct way to do so. Avoid flushing medications down the toilet or pouring them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.